Hello and welcome to today's presentation, a revision on cardiovascular diseases and nursing care process. First, we want to see the common cardiovascular diseases. And these are diseases involving the heart, that's cardiac, the blood vessels, that is vascular, and the heart valves, valvular. I hope that you are able to watch my previous videos on the anatomy and the physiology of the heart and the blood vessels. The common diseases include hypertension. Hypertension is a common condition where the force of blood against the artery walls is consistently too high, making the heart work harder to pump blood with any reading from 130/80 millimeters mercury and above. Cardiomyopathy. What is it? It is a disease of the heart muscle that makes it difficult for the heart to pump blood. The prolonged straining or injury of the muscles of the heart causes the heart to be enlarged, thickened, stiff, or scarred, as in types of cardiomyopathy, different types of cardiac muscles diseases. This is the normal heart, and this is dilated cardiomyopathy, where we have enlarged ventricle. As you can see, the cardiac muscles are overstretched and the ventricle is ballooned up. This is dilated cardiomyopathy. Then we have hypertrophic cardiomyopathy, which has thickened left ventricle wall. This is the thickened left ventricle wall. Then we have fat and scar tissue formation at the right ventricle, and this is known as arrhythmogenic cardiomyopathy. Then lastly, we have restrictive cardiomyopathy, where we have stiffened wall, as in this case of the left ventricle. The wall is stiffened. And therefore, this cardiomyopathy types affects the normal functioning of the cardiac muscles, mainly contracting to push blood out of the ventricles, or relaxing to allow filling of blood into the ventricles. So that function is not efficient. Congestive cardiac failure, also known as congestive heart failure or disease. It is a chronic condition where the heart muscle cannot pump blood efficiently, causing blood congestion in the heart and then other parts of the body. It can occur at the left, right, or both sides of the ventricles. This is a picture depicting the congestive heart failure. This is a normal heart, and then this one here, there is heart failure. You can see the left ventricle is ballooned, overstretched until the cardiac muscles are thinned out, and there is reduction of oxygen-rich blood pumped to the body through the aorta. There is also dilated left ventricle. Then we have another feature of the congestive heart failure, which is enlargement of the heart. This enlargement of the heart causes chest congestion. It builds some pressure within the chest and causes shortness of breath and also excess fluid around the lungs. Another feature is swelling in the legs and feet, known as edema. Coronary artery disease, also known as myocardial infarction or coronary heart disease. This disease occurs when the heart's main blood supply vessel, which is the coronary artery, narrows, usually from plaque buildup, a condition known as atherosclerosis. Accumulation of fat, cholesterol, and other substances, and this restricts oxygen-rich blood to the heart muscles. This is the coronary artery disease, which has accumulation of plaque within the artery, narrowing the lumen of the artery and reducing the blood supply to the heart muscles. This is a normal coronary artery, and this one has plaque in it. So when this blockage is complete, it can lead to heart attack. Deep venous thrombosis. It is a condition where a blood clot forms in a deep vein, usually in the legs, blocking blood flow. Rheumatic fever, which is an autoimmune inflammatory illness that can affect the heart, joints, brain, and skin, occurring as a rare complication after an untreated streptococcal throat infection. Valvular disease or diseases. This is when one or more of the heart's valves, that is the mitral, the aortic, tricuspid, and pulmonary valve, don't open or don't close properly, disrupting the heart's ability to pump blood efficiently in one direction. This is the damage or defect in one or more of the four valves. These are the four valves. Either damage or defect. This is the tricuspid valve. When it is damaged or there is a defect, then it doesn't open properly to allow blood into the right ventricle. Again, cannot close properly to prevent backflow of blood into the right atrium. That is what it means, not able to open and close properly. The same occurs to the pulmonary artery. It allows when there is a valvular disease, it means the pulmonary valve cannot close properly. So it allows some backflow of blood from the artery into the right ventricle. The same way, it doesn't open properly to allow blood from the right ventricle into the artery. The same affects the aortic valve and the mitral valves. These defects could be due to rheumatic fever causing inflammation of the endocardium, a condition known as endocarditis, damaging the valves to cause stenosis or regurgitation, hardening or allowing backflow of blood, meaning that the valves become incompetent by not opening well to allow blood in or not closing well to prevent backflow of blood. General causes, risk factors, or etiological factors of common cardiovascular diseases. If you meet these terminologies in an exam, whether general causes, the risk factors, or etiology, they mean the same. Lifestyle choices, smoking or vaping. The smoke has a lot of toxic which damages the heart and blood vessels. Unhealthy diet, high sugar, salt, unhealthy fats like saturated fats and cholesterol can cause accumulation of these fatty substances within the blood vessels and lead to cardiovascular diseases. Physical inactivity, a sedentary lifestyle, leads to weaker cardiovascular muscles and poor circulation. Alcohol abuse. Excess alcohol damages the blood vessels, including the heart muscles and even the valves. Stress. Emotional stress can worsen other risk factors like raising the blood pressure. Poor dental health. Microorganisms from unhealthy gums can enter the bloodstream and cause inflammation of the cardiac muscles. High blood pressure, a condition known as hypertension, most frequent and significant risk factor of cardiovascular diseases. If one has high blood pressure for a long time, it predisposes them to other cardiovascular diseases. High cholesterol in blood. This leads to plaque buildup, a condition known as atherosclerosis. Diabetes, which is poor blood sugar control, which raises the risk of one having cardiovascular diseases. Obesity and overweight. It worsens other risk factors like fat accumulation, poor venous return, and varicose veins. Metabolic syndrome, a cluster of conditions like fat accumulation, which increases the heart disease risks. Other factors: age and sex. Risk increases with age, especially after menopause for women. Family history and genetics. A family history of early heart disease increases one's risk of having cardiovascular diseases. Air pollution. An environmental factor can also increase the risk of cardiovascular diseases. Socioeconomic factors like poverty, lack of education, and urbanization predisposes people to cardiovascular disorders. You should also note that these factors can be classified as modifiable, like the lifestyle factors, and non-modifiable, like the genetics or age, and you should be able to note the difference. General features of cardiovascular diseases, all manifestations, all signs and symptoms. There is chest pain or discomfort. There is pressure, which feels like squeezing, tightness, or aching, potentially radiating to the arms, back, neck, jaw, or stomach. Shortness of breath, a condition mostly referred to as dyspnea, and this is difficult breathing, especially with activity or even lying down, becomes a problem. Fatigue, unusual tiredness or weakness due to poor blood supply to the brain and other body cells. Dizziness, lightheadedness, or fainting. Feeling faint or losing consciousness because of inadequate supply of oxygen and nutrients to the brain. Palpitations, feeling the heart flutter, beat too fast, or beat irregularly. Swelling, a condition known as edema. This is the fluid buildup in the legs, ankles, feet, and the abdomen. What are the key pathophysiological mechanisms of cardiovascular diseases? How does this disease occur? First, we have atherosclerosis, also known as artery hardening. Chronic inflammation and lipid accumulation in artery walls forming fatty plaques. The plaques narrow arteries, a condition known as ischemia. They become unstable and rupture, triggering clot formation, condition known as thrombosis, leading to a heart attack if a thrombus occurs within the coronary artery. It can lead to heart attack, or it can lead to stroke if the blockage is to the brain. Hypertension or high blood pressure. High pressure damages the artery linings, leading to left ventricular hypertrophy, that is thickening of the heart muscles and fibrosis, and damages the heart, worsening cardiovascular diseases. Fibrosed cardiac muscles cause ventricular compliance, that is diastolic dysfunction, meaning impaired filling of blood into the ventricles, and eventually systolic dysfunction, that is the weakened pumping of blood from the ventricles, leading to heart failure. Inflammation and oxidative stress. Chronic inflammation and reactive oxygen species, those are the free radicals within the body, damage the cells, lipids, and deoxyribonucleic acid, accelerating a condition known as atherosclerosis and contributing to tissue remodeling and scar formation. And this leads to cardiovascular diseases because it affects mainly the blood vessels and the endocardium. Myocardial ischemia and infarction. Sometimes it is referred to as heart attack. Reduced blood flow, a condition known as ischemia, due to narrowed coronary arteries because of accumulation of plaque, causing oxygen deprivation to the cardiac muscles. The deprivation leads to myocyte death. Myocytes are the heart muscle cells. They die, and loss of contractile function. They lose the contracting function, potentially causing heart failure or arrhythmias. What is the difference between a heart attack and cardiac arrest? Heart attack is blood flow problem, blocked blood flow, while cardiac arrest is an electrical problem, cardiac outage, power outage. The heart conduction system fails. A heart attack can trigger cardiac arrest and not vice versa. These are the pictures. This is the cardiac arrest, the cardiac power outage. While in the heart attack, there is blockage of blood supply to the heart muscles, affecting its functionality. It cannot contract and relax properly or efficiently. Heart failure. The heart cannot pump enough blood for the body's needs due to damage from hypertension, ischemia, or cardiomyopathy. That state is referred to as heart failure. The heart has failed its functions. The impaired pumping, which is systolic, or filling, which is diastolic, leading to fluid buildup and tissue hypoxia. That is inadequate oxygen within the body tissues. Arrhythmias, also known as irregular heartbeats. It can occur from electrical instability, from structural damage, a condition known as fibrosis or dilation, or from stress, or from electrolyte imbalance, or from drug reactions. The electrical instability causes inefficient pumping, reduced cardiac output, and increased stroke risk. the body's compensation mechanism. Increased heart rate. The heart beats faster to try to circulate more blood, which worsens high blood pressure. Hormonal responses. The body releases hormones to retain salt and water when there is an electrolyte imbalance within the body tissues and cells, which unfortunately worsens fluid buildup. This occurs when there is congestive cardiac failure, there is electrolyte imbalance within the body tissues and cells. So these hormones are produced to retain more water, and this worsens the already impaired cardiovascular system within the body. What is the nursing process, which is our backbone here? We have seen anatomy and physiology of the cardiovascular system, the common cardiovascular diseases, common etiological factors, the common features or manifestation, pathophysiological mechanism of cardiovascular diseases. Now, let us look at the nursing process and the nursing care plan. What is a nursing process? The nursing process is a systematic framework for critical thinking in nursing, abbreviated as ADPIE. A for assessment, D for diagnosis, P for planning, I for implementation, and E for evaluation. What is a nursing care plan? Now that we've known a nursing process, what is a nursing care plan? Nursing care plan is a product of the planning step, a specific documented blueprint for individualized patient care which has columns of assessment, objectives, outcome, interventions, implementation, rationale, and evaluation. Always ensure that you clearly understand the question, whether it is testing, understanding, or application. Consider the allocated marks and the section of the question and respond according to what is required. If the question is on nursing care management, present a nursing care plan. If you are not sure, do the nursing care plan. So this is the nursing process. The nursing process according to the Nurse Labs website. First, assessment, diagnosis, planning, implementation, and evaluation. What happens at each stage? Assessment involves gathering subjective and objective data. Subjective is patient's words, and objective is from what you get from vital signs and investigations. And you should understand the patient's health status during assessment. After assessment, you do the diagnosis. Before doing the diagnosis, you are supposed to identify actual, potential, and health promotion or syndrome health problems to be managed. These diagnoses are made in either 1, 2, or 3-part statements. After the diagnosis, you move to the planning section. Planning, you should prioritize according to human hierarchical needs. Make smart objectives and interventions to achieve them. What does SMART mean here? S stands for specific. This means that you should address the patient's needs: physical, emotional, psychological, social, among others. Then M stands for measurable. Your specific objective has to be measurable, meaning that it has to be observable. It has to be quantifiable. It must have a quantifiable outcome. For example, something you can measure at the end is 4 glasses of water. Instead of writing, the patient will be able to have adequate water or adequate fluid. So you have to plan on something which you can quantify or something which you can measure at the end to see whether you've achieved what you wanted to achieve. That is what is measurable. Then A stands for achievable. What you as a nurse can do at your level. What are you able to do at your level? That is something achievable. Like the nursing care, relieving pain, ambulating the patient, feeding the patient. Those are achievable, specific objectives. Then R stands for realistic. These are holistic needs for the patient. The holistic means that the things which affects the health of this patient have to be looked into. That is the physical, the emotional, the social aspects. And then T stands for the timeline. As you make your specific objectives, you have to give timeline for it to be a SMART objective. Like, at what time do I want to achieve my objective? Could be after 1 hour, after 3 hours, after 12 hours, after 6 hours, or after 24 hours. It must have time. If it doesn't have time, then it is not a SMART objective. After doing the planning, then you move to implementation. Here, it is about performing the nursing actions, the interventions. Then evaluation. Evaluation simply means determining the effectiveness of an intervention for further planning about the patient. I want us to look at the types of nursing diagnosis. We have problem-focused diagnosis. This problem-focused diagnosis at times is referred to as actual problems. Many times in an exam, they always ask for actual problems. So you will not be able to get the marks if you write the risk problems, or if you write the health promotion problems, or if you write the syndrome problems. So always be keen what the question requires. So an example of a problem-focused or actual diagnosis is ineffective breathing pattern related to decreased lung expansion as evidenced by dyspnea, coughing, or difficult in breathing. Risk diagnosis, an example, risk for ineffective airway clearance as evidenced by accumulation of secretions in the lungs. Nursing diagnosis for health promotion. It can be readiness for enhanced family coping as evidenced by verbalization of desire to information that will enhance health choices. And then we have syndrome, which is chronic pain syndrome as a diagnosis, the most simple diagnosis to make. So many times they always want the actual problems, the problem-focused diagnosis. One-part nursing diagnosis statement. Health promotion and syndrome nursing diagnoses are typically written as one-part statement because the related and evidence factors remain constant. Example of a rape case. The nursing diagnosis in health promotion or syndrome could be trauma syndrome. That is enough. One-part nursing diagnosis. Two-part nursing diagnosis statement. Mostly is on the risk nursing diagnosis. So risk nursing diagnosis have two-part statements. The first part is the diagnostic label, and the second is the validation for a risk nursing diagnosis or the presence of risk factors. It's not possible to have a third part for risk diagnosis because signs and symptoms do not exist. Examples of two-part nursing diagnosis. Risk of infection as evidenced by weakened immune system response. That is the best example of a two-part nursing diagnosis statement, mainly on risk problems of the patient. The three-part nursing diagnosis statement. The three-part nursing diagnosis statement is also called PACE format, which includes the problem, etiology, and signs and symptoms. It identifies the patient's actual problem using the standardized terms from NANDA 1, that is the North American Nursing Diagnosis Association. What is the problem here? The diagnostic label, like hypothermia. What aids one or the data which makes the patient's medical diagnosis? Those are referred to as the problems. So the diagnostic label, like hypothermia. Etiology, the related factors or cause indicated by related to as the cause, related to the cause. Then signs and symptoms, which define characteristics indicated by as evidenced by. So evidenced by sign or symptom, related to cause or etiology. For example, a patient with a medical diagnosis of malaria with a fever of 39 degrees Celsius. The three-part nursing statement could read, hypothermia related to an infectious process as evidenced by elevated body temperature, flushed skin, and increased pulse rate. Examples of nursing care plan diagnosis, problem or first part already stated for cardiovascular diseases. So I want you to complete the remaining two-part statements in your own discussion groups. That is on impaired swallowing. That is the first statement. You are supposed to finish the two-part statements. Impaired swallowing related to as evidenced by. Impaired tissue perfusion or ischemia related to as evidenced by. The same to effective breathing pattern, sleep deprivation, knowledge deficit, physical immobility until you finish. Then you will have mastered the three-part diagnosis. This is still the three-part diagnosis. These are the first parts of the problems with the cardiovascular diseases. Then I want to give you an example of a nursing care plan template. First, what is a nursing care plan template? It is a framework showing the specific nursing care a nurse should give. So a nursing care plan template, there are several templates with different number of columns, but this is the recommended one for nursing students. Example for patient X. Medical diagnosis is myocardial infarction. So you have to write the client's name, care plan initiated by the nurse who is doing the care plan, and the date. So it has 6 columns. The first column is for assessment, and which type of assessment? We have subjective data, and this is from the patient, like chest pain or fatigue, which could be reported by the patient. Apart from the subjective data, we have objective data, which you as a nurse, you should get from history taking, observation of vital signs, physical examination, and investigations. Then the second column, which is nursing diagnosis. For example, in this case, physical immobility related to pain as evidenced by facial expression and patient verbalization. Then goals and outcomes. Patient reports pain relief and is able to walk. So the goal is patient reports pain relief, and the outcome is patient being able to walk. So nursing intervention here is to administer prescribed analgesics and oxygen therapy. Rationale: analgesic is to relieve pain, oxygen for adequate oxygenation or perfusion. Then evaluation as the last column. Patient reports pain relief and can perform daily activities. What are the types of patient diagnosis? Normally, we have the nursing diagnosis, the medical diagnosis, and collaborative problems. The nursing diagnosis are given as examples are given here, like disturbed body image, risk for unstable blood glucose, impaired urinary elimination, or self-care deficit. Then medical diagnoses are things like pneumonia, type 2 diabetes mellitus, post-op prostatectomy, cerebrovascular accident. Then collaborative problems include things like myocardial infarction or congestive heart failure, which needs a physician, which needs a neurologist, which needs a cardiologist, which needs a nurse specialist. So it is collaborative problem. So there is a reference for you to do more practice on this on Nurses Lab's website, The Nursing Process, a comprehensive guide on nursing care plan for cardiovascular diseases by Gil Wine, 2026. Keep in touch for more revision presentations, and thank you for watching.